Welcome to our JenTalk on ethics in health education. Ethics should not be an afterthought. Ethics come first. So in a lot of your readings, you'll find that the ethical considerations are the last chapter of a textbook or the last set of readings. In our class, we're going to start by talking about the ethical considerations that you need to have in mind as you plan curriculum for health education. Health educators work with and for people, communities, and oftentimes are trusted by vulnerable populations and disenfranchised communities. Following a code of ethics is a must, and explaining how you will do that in your curriculum plan is also a necessity. Ethical codes for health educators. According to the National Commission for Health Education Credentialing, NCHEC, which I know you're all familiar, there are six articles that one must follow as part of the Code of Professional Ethics. Article 1 focuses on the notion of a responsibility to the public. It's very important. A health educator's responsibility is to educate for the purpose of promoting, maintaining, and improving individual, family, and community health. So it's not about researching to understand it, it's about promotion. When a conflict arises in engaging in health educators must consider all issues and give priority to those that promote wellness and quality of living through principles of self-determination, that means the learner's self-determination, and their freedom of choice for the individuals in the members of the learning community. Principles of beneficence and non-maleficence are critical. Health educators must seek to do good and provide all aid and resources available to them, while also aiming to do no harm and avoiding practices that may cause emotional, physical, or economic harm to others. So you're oftentimes faced with dilemmas. You may wish to look another way so that you can continue the work that you're doing, and sometimes you can't. And you have to really think about promoting health and promoting wellness always, even if it may interfere with your original educational goals. Ethical Codes 2 through 3 for health educators. Article 2, responsibility to the profession. Health educators are responsible for their professional behavior, for the reputation of their profession as MPHs and health educators, and for promoting ethical conduct among their colleagues. People look to you and expect that the way that you will behave is how all health educators behave, which means when we make mistakes as health educators, when the next one comes along, trust could be an issue or a lack thereof. Article 3 is related to this and focuses on the responsibility to our employers or those who contract us, even if you're not being paid. Health educators recognize the boundaries of their professional competence and are accountable for their professional activities and their professional actions. Ethical Code 4 for health educators focuses on the responsibility to the delivery of health education. Health educators promote integrity in the delivery of health education. They respect the rights, dignity, confidentiality, and worth of all people by adapting strategies and methods to meet the needs of diverse populations and communities. If you had intended to use tweeting and social media and you're working with a community that doesn't have access to it, you don't expect them to figure it out. You adapt, you change. If you had examples within your health education materials that focus on a population that has a demographic very different from the one with whom you're working, you make changes. You think about the people with whom you're working and you adapt. You don't ask them to adapt. This notion of the principle of autonomy is related to this Article 4. Health educators must respect the rights and dignity of others, such as others may meet their full potential. Therefore, health education recipients or learners have the right to information, privacy, confidentiality, and appropriate care and treatment. They need to know what the health education is about. They have the right to remain private if they choose to partake in the education or they choose to opt out. They have the right to confidentiality, and we must provide appropriate care and treatment. The principle of truth-telling and honesty is critical in this act. Health educators should be honest with all members of an educational experience regarding what their goals are, how they will seek to educate others and why, and they will inform them of all aspects of their educated participation, of their expected participation, including how they can withdraw from participation if they choose to do so. So everything that you intend to do, everything that you're hoping for, all aspects of the experience that you are aware of needs to be disclosed, and we need to let people know at any time if you're no longer interested in participating, you can withdraw with no penalty, no punishment, no humiliation, no negative consequences. Ethical Code 5 for health educators. Responsibility in research and evaluation. Health educators contribute to the health of the population and to the profession through research and evaluation activities. When planning and conducting research or evaluation, health educators do so in accordance with federal and state laws and regulations, organizational and institutional policies, and professional standards. And what this means is you focus on those laws, policies, and standards within the context you are going to be working, whether it's a local community in the United States, California, Massachusetts, or if you go to Canada, policies, laws change, organizations within the same countries change. If you go to India, Africa, Iceland, Brazil, you need to consider laws, procedures, policies, cultures, and professional standards there. Ethical Code 6 for health educators focuses on the responsibility and professional preparation. Those involved in the preparation and training of health educators have an obligation to accord learners the same respect and treatment given other groups by providing quality education that benefits the profession and the public. Under that, the principle of justice applies. Health educators should treat all people justly and fairly by distributing resources fairly, respecting individual and group values and rights, and following morally acceptable laws within the culture one works and lives. You may be interested in proving that a certain kind of food product would increase the immune system of a group, and realize, if you also have research experience, that if you could give it to someone and withhold it from others, then you could possibly demonstrate that those who have it have improved immune systems over time. However, we do not go in as health educators, also as researchers with a control group and an experimental group. Instead, we're going in to treat everyone with the same kind of dignity and care. Therefore, you would fairly distribute this resource to everyone. If you go in it as a researcher, you're in a different position. Health educators provide care for all. Considering ethics, therefore, is an absolute must when you're writing your curriculum design projects. All health education curriculum plans should include a section on ethics. How will you do good and avoid inflicting harm? Think about this for your final project. You will be answering these questions between now and week 8. How does your plan promote health and wellness above all other things? How are you supporting the mission and goals of the profession as a health educator and those who have contracted you to engage in your education project, whether they're paying you or not? How will you communicate with and inform your participants of your project's goals and expectations? How will you handle those who wish not to participate or support your efforts? Which policies and laws should you consider before you engage in your project? You want to do your research. And how will you learn about and respect the cultures you enter when you engage in your educational project, be they organizations, communities, etc.?